Microbes. Teeny tiny microorganisms that cover every inch of every surface that we see and touch, including us. Mostly, we think of microbes as harmful little guys that give us infections and make us feel bad. But, in fact, we need those microbes in us and on us in order to remain healthy. So, what happens when these healthy bacteria are being killed off? I want to create awareness about the antimicrobial stewardship movement, which works with doctors to cease the overprescribing of antibiotics to save our normal flora. First, a little history on antibiotics. It was in 1928 when Alexander Fleming created the first true antibiotic, penicillin. And from that point on, antibiotics have been a useful tool in helping to treat ailments such as strep throat and pneumonia. But beginning in 1947, the overproduction and overprescribing of penicillin led to the first known case of antibiotic resistance. The unfortunate fact is that most of us will be admitted into the hospital at some point in our lives. And annually, 1.7 million patients acquire nosocomial or hospital-acquired infections during their stay. So what happens when we get one of these infections? In a hospital, no less. And not even the most trusted antibiotics can help to treat us. Antibiotic resistance is the ability of a microorganism to withstand the effects of an antibiotic. So, when a person takes an antibiotic, the drug kills its defenseless, healthy bacteria, leaving behind the bacteria that can resist it. These renegade bacteria then multiply, increasing their numbers 1,000,000-fold in just one day, becoming the predominant microorganism. Disease-causing microbes thwart antibiotics by interfering with their mechanisms of action. For example, penicillin kills bacteria by attaching to their cell walls, then destroying a key part of that cell wall. The wall falls apart, and the bacterium dies. Resistant microbes, however, either alter their cell walls so that penicillin can no longer attach to it, or they produce enzymes that dismantle the antibiotic. Antimicrobial stewardship is a coordinated program that promotes the appropriate use of antimicrobials, including antibiotics. It improves patient outcomes, reduces microbial resistance, and decreases the spread of infections caused by multi-drug resistant organisms.